Go up on home care packages, that is a good thing. But one thing we know, even from the Aged Care Royal Commission's final report, sometimes you can increase spending for home care packages. Doesn't mean that the money actually delivers a lot of care for those who need that care. Either way, it's going to be a ton of money, according to the Health Minister, Greg Hunt.
It will be a record investment in aged care, and it will also be a record response to any Royal Commission in Australian history. So the largest investment in aged care and the largest response to any Royal Commission in Australian history.
So how do we make sure that money actually gets to those who need it? Dr. Sarah Russell joins us. She's a public health researcher and she's co-founder of the lobby group Aged Care Reform Now. Sarah, good afternoon.
Good afternoon.
What are you looking for out of the budget? What do you want to see beyond just the dollar figures?
I want to see transparency and accountability. I'm very tired of hearing stories from recipients of home care packages who are just not receiving the support they need to stay at home. People on level 4 packages are getting $52,000 or a little bit more than that every year to stay at home. And in some cases, as the Royal Commission report said, the average amount of support they're getting is 8 hours and 45 minutes per week. That's around an hour a day for $52,000. Where is that money going?
Can you give us an example, Dr. Russell? I mean, I saw that number, which is, of course, why I wanted to talk to you. But $52,000 for what? I think it's an hour and 10 minutes a day. How does that end up happening?
Well, first of all, we have to make the point at the outset that there are very good home care providers doing the right thing. They are charging a reasonable amount of case management and admin fees to process the package. They're sending in support workers who are reliable, turn up on time, create lovely continuity of care, so the same workers turn up every day, so people develop relationships with their support workers. That's what should be happening across the board. But in fact, it's not happening. Some people I have interviewed, and I've looked at their financial statements, they're getting about 53, some of them are 53% of the package is going out in admin and case management fees. And on top of that, the support workers who are being paid around $25 to $30 an hour, but the client is being charged $60, $70 an hour, and in some cases on public holidays, $130 an hour. So it's just, I've called it rorting in the article you read today. I think we should call this rorting. I think there are some providers who are rorting the system, and I think there needs to be consequences.
How do you do that? How do you make sure, or how do you create a system where all of that money ends up as care on the ground?
I'm sure people know how to do this. The irony for me is I was asked to do this research by Ken Wyatt when he was the Aged Care Minister, and I was given $50,000 to do this project. I had to account for every cent in my acquittal to the Health Department. Every cent that I spent on my project had to be acquitted. So that's the irony for me. They gave me, a small amount of money, about the same as a home care package, and I had to account for everything. These providers, I think some of them are getting away with it's just terrible in my view, because people want to stay at home, and if you haven't got good family support, how could you possibly stay at home with only 1 hour a day of help?
Can you design a system to make sure the money ends up with those who need it?
Look, I'm not an accountant. I can't even balance my own checkbook. But I am sure we can. I'm sure if they're using government money, it's government money, it's our taxes, surely the government and the Health Department can sort out a way. And if they can't do it, if they really can't do it, that's why we need to adopt Tony Piccone, the Royal Commissioner's recommendation, and just let's start completely afresh with a completely different department to look after aged care, not the Health Department. We'll get an Australian Aged Care Commission and we'll do it all from scratch and we'll start again. I actually support that. I think let's just start again.
Well, I don't think we're going to see that tomorrow. We'll see some extra money, but we'll see how it goes. Sarah, thanks so much for your time.
My pleasure. Bye-bye.
Dr. Sarah Russell there from Aged Care Reform Now. The other one I can never quite understand is when you do get a bit of aged care support in the home, why is it a different person every day? The agencies hate giving you the same person every day. And I never really understood why that is. Gary's in Gisborne. You're working inside the system, eh, Gary?
That's right, Raph. I'm a case manager with an aged care provider. The problem that we face all the time is that we just can't get the staff. It is just such a poorly paid and pretty much badly treated profession that it's full of transit workers. It's a very, very casualised workforce, and there is no training required. So if you find a good worker, they're always in good demand.
So we need to raise their training and their qualifications. That's more money.
Yeah.
More systems.
Absolutely. But if you haven't got the good workers, you can't care for people in their home properly.
Good point, Gary. Look, thank you. I mean, it's always a workforce issue, same as the emergency department ambulance ramping issue. You've got to have well-qualified people staffing your primary care. Otherwise, you end up in trouble. Kathy's in Queenscliff. What do you want to tell us, Kathy?
Well, I spoke to you a few weeks ago. I was as a level 2, assessed as a level 2 person, but they offered me a level 1. Now, and that's $9,000 towards the cost of my care. And because I have a very small superannuation that's running out, because I've been retired for about 20 years, I had to pay $15.57 a day before we start any care money.
Oh, that's right. You knocked it back because of that, didn't you?
Yes, because it was $5,683 a year out of that $9,000.
How are you coping without the home care, though?
Well, I'm getting home care from the local borough.
Right, okay. Yeah,
which is very good.
Yes.
Which is very good. But then if I went to a home care package, a government package now, I would still have those people, but I would be paying commercial rates for them out of that 9,000, of which, I have 5,600 and,
Yeah. How are you going, Kathy? Are you getting the help you need?
Well, I'm getting the help I need, yes, but I could do it more because by evening it's very difficult for me to cook. I have a walker, but it's very hard to stir things on the stove and you just don't feel like it.
Yeah, I understand, Kathy. Look, good luck. I really appreciate you talking to us again. Some of your texts give a real illustration of this. My relative was charged $900 by the aged care provider, $900 for a $50 plastic chair for the shower. Someone else saying this, our researcher was mentioning that 50 grand gets you about an hour and 10 minutes a day. Someone's saying this, totally agree. Same happening with the NDIS, $60,000 package. It's buying us 9 hours a week. It's criminal. It needs investigation and exposure. Sally's got a parallel story. My 91-year-old dad is on level 4 home care package, the highest. He gets maybe 3 hours a week if he's lucky. Providers say they don't have the staff. So money's one thing. Making sure it trickles down and actually has an impact is something else. Don't forget, you're going to get complete federal budget